So, what we're going to talk about today is how should a healthcare professional identify a tongue tie, because many of us are worried about tongue ties in our babies. Many will have seen a check happening and then the chin is kind of taken down and the healthcare professional will check inside. But Angela from Latch On Lanarkshire Bare Necessities is with us today on this lovely windy day. So what when you're doing a check, as obviously if you could let us know what are your qualifications. Obviously you're a former health visitor, breastfeeding support worker, what are we?
I am an international board certified lactation consultant, so an IBCLC is a shortened version, and I've been an IBCLC for over 20 years.
So loads and loads of experience.
Yeah. I've been a tongue tie practitioner for 15 years.
Okay, and what should parents be looking for when their babies are being checked? What should happen in a check?
So tongue tie is not about the appearance of the frenulum. Everyone thinks if a baby has tongue tie, then it's a little bit of stringy material, skin
Tissue
from the tip of the tongue to the floor of the mouth, and it's very visible. But a baby could have a frenulum like that, but their tongue function could be good. So when you're doing a tongue tie assessment, you are checking for tongue function and tongue mobility. So when I'm doing a check, the first thing I do is check if baby's tongue moves laterally, so running my finger from the inside of the cheek round to the other side of the cheek. And as you run your finger along, the baby's tongue should follow your finger. You're looking at the tongue as well and what the appearance is, and is there a little dimple in the middle when the baby cries? Does the tongue elevate?
Like a love heart shape?
Yeah, and do you see that indentation? Can you see that the blade of the tongue is being pulled back down? You're looking at the frenulum as well. Is the frenulum soft and elasticy, or is it tight when you put your finger in the middle underneath the baby's tongue, right in the middle? Can you feel a very tight band? What else are we looking for?
Would they be checking how baby sucks?
Yeah, after doing the physical examination, can the baby stick their tongue out? And if you put, I usually touch the baby's tongue and pull my finger down, and a baby would normally, their tongue would come out. And lots of people will say, oh, the doctor checked and the baby can stick their tongue out, so there's no tongue tie. But that's not a proper assessment either. You need to do a full assessment looking at all the different movements and function of the tongue.
What should parents be looking out for troubleshooting with a possible tongue tie?
If mums are getting pain when they're feeding and they're quite sure that the latch is as good as they can get, they can get their baby on, and their baby's got a nice big wide open mouth. If they're still experiencing pain, despite having some support to get a better latch, then that could be an indication. If they get a good latch and the baby continually slips off, then that as well could be an indication. If the nipples are sore, misshaped, then that's another indication that there could be a tongue tie.
Brilliant. If you've got any more questions about tongue tie, Angela is available most days. I will put her details on the chat, and thanks for listening.